Your orthopedic surgeon has recommended surgical repair of your injured shoulder. This is a brief overview to help you prepare for recovery and rehabilitation that will follow. While your surgeon has created a detailed plan to repair your shoulder, we will not know the full details until after your surgery. The following is general information intended for all patients planning shoulder surgery. However, you will want to refer to your surgeon for specifics. The shoulder is a complex joint that allows a large degree of motion. The sacrifice for this freedom of mobility is stability. The shoulder relies upon soft tissue for both movement and support. Imbalance of these soft tissues leads to dysfunction, pain, or instability. Your surgical repair may involve bone, cartilage, ligament, tendon, and/or muscle. Post-operative instructions are intended to help you protect your repaired tissue. In most cases, the surgeon will order movement limitations of your surgical arm for a period of time, which will restrict activities that you may be used to performing on a regular basis. Due to this, we recommend that you practice being one-handed and using your unoperated arm to perform tasks before your surgery for an easier and safer transition home, especially if your dominant hand is on the side of your planned surgery. Practice tasks such as writing or typing, chores, hobbies, and work duties without straining. Following surgery, your arm may be placed in an immobilizer brace or a sling. Regardless of the type of brace or sling, all have the same purpose of reducing tension on repaired tissue for optimal healing. Precautions vary depending on surgery and the individual. Follow them closely as you cannot speed up the recovery process until your surgery is adequately healed. Plan for your coach, usually a family member or a close friend, to be present and actively listening when receiving education from the surgeon and staff, as medication and lack of sleep will affect your ability to recall information. Your coach should stay with you the night of the surgery. Do not drive or operate machinery for 24 hours after surgery or while using narcotic pain medication. Practice bathing and toileting hygiene with your unoperated arm before surgery. Flushable wipes are helpful with toileting in general. A long-handled bath sponge may assist with bathing and drying difficult-to-reach areas. Following surgery, you may be allowed to clean your surgical arm with limited motion. While standing on a firm, non-skid surface, remove your brace with your arm resting on a countertop or a table. This prevents using the supporting muscle of your surgical shoulder. Then unfasten the straps. Reach your unoperated arm across to scoop and cradle your surgical arm like a baby. Remove your arm from the brace and place your surgical arm next to your body. Slowly release your arm and allow your surgical arm to dangle by your side. Be sure to relax the muscles of your neck and your surgical shoulder. Then, slowly lean forward, continuing to allow your arm to dangle. Do not use the muscles of your surgical arm. This motion allows safe access to your whole arm and underarm for cleaning, drying, and applying deodorant. Support your surgical arm with your unoperated arm prior to standing and applying brace. While standing on a firm, non-skid surface, remove your brace with your arm resting on a countertop or table. This prevents using the supporting muscles of your surgical shoulder. Then, unfasten the straps of the brace. Reach your unoperated arm across to scoop and cradle your surgical arm like a baby. Remove your surgical arm from the brace and place it by your body. Slowly release and allow your surgical arm to dangle by your side. Be sure to relax the muscles of your neck and your surgical arm. Then, slowly lean forward, allowing your arm to dangle. Do not use the muscles of your surgical arm. Dress your surgical arm first before dressing your unoperated arm. Support your surgical arm with your unoperated arm prior to standing and applying brace. To undress, reverse the process, undressing your surgical arm last. You will want to avoid shoulder straps that apply pressure to your shoulder. Examples include bras, purses, suspenders, or bags. To avoid strain on your surgical shoulder during lower body dressing, we recommend loose pants or loose shorts with an elastic waistband and closed-toed slip-on shoes. Plan ahead and ask your coach for assistance as needed. If you require specific shoes that do not easily slip on, your occupational therapist will be able to teach you safer techniques using a reacher or another assistive device. Flip-flops should be avoided as they do not offer any toe protection, can easily fall off, and can be a tripping hazard. Remember to avoid any strenuous motion with your unoperated arm that can recruit the muscles of your surgical shoulder. Assistance may be required for traditional two-handed activities such as opening containers, meal preparation and cleanup, and laundry. You may want to prepare meals ahead of time. Pre-cut and soft foods are also good options. Initially, activities that are strenuous or require whole-body movement should be avoided. Examples include vacuuming, mowing the lawn, and shoveling snow. Caution should be taken to prevent overdoing one-handed activities, as the motion from your unoperated arm can radiate to your surgical shoulder. For example, lifting a 50-pound bag of dog food with your unoperated arm would be like lifting 25 pounds with your surgical arm. To avoid this, limit activities to 15 minutes or less until you are sure that you are not recruiting the muscles of your surgical shoulder. Stop any activity if the muscles of your surgical shoulder begin to tense or feel painful. Keyboard use should be limited to unoperated arm until instructed otherwise. Following your surgery, start pain medication when sensation is beginning to return to your shoulder. It may be necessary to take your pain medication at regular intervals the first few days, including at night. It is helpful to keep a pain medication log to avoid over-medicating. Pain medication is most effective if taken before pain becomes severe. Always take your pain medication with food to reduce the risk of nausea. Apply ice packs to your surgical site. Keep the ice on for 15 minutes, then leave off for at least 15 minutes. Do this frequently for 2 to 3 days, then 3 to 4 times a day throughout recovery. When icing, protect your skin with a light cloth over the ice pack. You can make your own ice pack by mixing 1 part rubbing alcohol with 2 parts water in a resealable bag, or by placing a 1-pound bag of rice in the freezer. Ensure your brace or sling provides comfortable support of your surgical arm as instructed. Remember to keep your shoulder muscles relaxed and avoid shrugging your shoulders. Sleep is essential to healing. However, lying flat may not be tolerable early in the healing process. If it is not, try resting in a semi-reclined position, such as a recliner or a sofa with pillows to prop up and support your upper body, arms, and head. Your immobilizer is to be worn 24/7, except for dressing and bathing, or as otherwise instructed, with your brace on a firm surface, about the height of your elbow in front of you, and your surgical arm next to your body. Reach your unoperated arm across to scoop and cradle your surgical arm. Slowly lean forward while keeping your surgical arm completely relaxed and supported. Place the elbow of your surgical arm fully in the pocket. Then connect the neck strap. Place the curve of the brace pillow against the curve of your ribs, keeping the top level. The pillow should be between your body and your arm, not below your arm. Secure the forearm strap to hold your arm, but make sure it is not too tight. Then secure the thumb strap. Connect the waist strap. Align your thumb with your nose while keeping your forearm level. Your shoulders should be fully relaxed. At this point, your brace should completely support your arm. The included ball is a reminder for occasional, gentle squeezing. Reverse this process to remove your brace. If you have any questions regarding your surgery, please contact your surgeon.